So now we're going to discuss one last topic in the development of CVS. Yes, that is about the fetal circulation. Right. So now we're going to draw one flow chart and then we can see the diagram. Now we have to start from the placenta. So now from placenta, the umbilical vein will carry the oxygenated blood. So umbilical vein carrying the oxygenated blood from the placenta. And we have two umbilical veins, right and left. In that, right umbilical vein will disappear and the site of regression of right umbilical vein will be forming the potential site for one hernia called gastroschisis. Now again, don't worry, we discuss about gastroschisis in the development of abdomen in detail. Now here, please remember, we have only left umbilical vein. Right umbilical vein will disappear. Now, after arising from the placenta, left umbilical vein, which in turn passes through liver and then which drains to, IVC. So now, we have a shunt, the left umbilical vein, instead of passing through the liver, which goes directly to IVC, and that shunt is our ductus venosus. So ductus venosus bypasses the liver and in turn joins with the IVC, inferior vena cava. Okay, so first shunt we have. Now superior vena cava also carries the blood from the upper part of the body. The superior vena cava and the inferior vena cava, they give the blood to the right atrium. Now we have a shunt from right atrium to left atrium. So majority of the oxygenated blood coming to the right atrium, will go to left atrium via foramen ovale. I hope you know that. So blood from the left atrium, which in turn goes to left ventricle. Now blood from left ventricle, which in turn goes to aorta. So now from the aorta, the oxygenated blood which is given to brain. Oxygenated blood which in turn given to brain. We need the oxygenated blood to the brain. Now the venous blood from the brain, which in turn carried by superior vena cava, that in turn comes to right atrium. Now some blood, small part of blood from the right atrium will come to right ventricle. Now from the right ventricle, the pulmonary trunk. Now lungs is not functional, no? So lungs will start its function only after the birth of the baby. So now from the pulmonary trunk, we have a shunt to the aorta. That shunt is called ductus arteriosus. Ductus arteriosus. So blood from pulmonary trunk, which in turn goes to aorta via this shunt, ductus arteriosus. Now from the aorta, common iliac artery. Common iliac artery arise from the common iliac artery. We have umbilical artery. And this umbilical artery, which in turn end in placenta. So that's all about the fetal circulation, right? Now, so circulation over. Now we will discuss about the shunt. Okay. So now the shunt, first one, ductus venosus. Okay. Now the ductus venosus, it is a shunt connecting the left umbilical vein to the IVC without passing through the liver. Without passing through the liver, the blood from left umbilical vein will be given directly to IVC. That is a ductus venosus. First. Now we have a shunt between the right atrium and the left atrium, that is a foramen ovale. Okay. And we have a shunt between the pulmonary trunk and the aorta, and that is our ductus arteriosus. So we have these three shunt. Okay. Right. Now see the diagram. The same thing we are seeing in the diagram. Now the oxygenated blood from the placenta enters the right atrium via inferior vena cava. Now the ductus venosus shunt the oxygenated blood from the placenta away from the semi-functional liver towards the heart. So from the left umbilical vein, the blood will be given to, inferior vena cava bypassing the liver through this ductus venosus. Okay, Right. Now, second shunt. The right atrium receives the blood from superior vena cava and the inferior vena cava. So, right atrium and the left atrium, we have a shunt. That is our foramen ovale. Allows the oxygenated blood from the right atrium to reach left atrium. Now, from the left atrium, the blood will go to left ventricle. From left ventricle to aorta. So, from aorta, that will supply mainly, the oxygenated blood mainly goes to brain. Okay. Number 3, some amount of blood from right atrium will go to right ventricle to the pulmonary trunk. Now, from the pulmonary trunk to the aorta, we have the connection. What is that? Ductus arteriosus. So, why we have shunt between the pulmonary trunk and the aorta? Because the lungs will start its function only after the birth. So, the blood from the pulmonary trunk is shunted to aorta through ductus arteriosus. Okay? Ductus arteriosus connects the aorta and the pulmonary trunk. Okay, sir. Then the last one, the mixed blood vessels to the head and neck and back, they are back to the placenta via aorta. So, aorta and the common iliac artery, umbilical artery, and then to placenta. Okay? Now, next we are going to discuss important topic. What are the changes will take place after the birth? Now, first and foremost point about the umbilical vessels. We have one umbilical vein and two umbilical arteries. Now, out of the umbilical vein and the umbilical artery, which is the first structure to close? Umbilical artery or umbilical vein? Any guess? Umbilical artery will close before the vein. Umbilical artery close before the umbilical vein. Why, sir? Now, umbilical artery carry the blood to placenta. So, we don't need any blood loss from the baby. So, first umbilical artery will close before birth. Okay? Right. So, now this umbilical artery will regress. The proximal part of umbilical artery will form superior vesical artery. The distal part of umbilical artery obliterates. Okay? Right. Now, second, closure of umbilical vein and ductus venosus occurs shortly after the closure of the artery. So, the blood from the placenta enter the newborn sometime after the birth, for some time after birth. That is why artery is closing first and then vein is closing. Okay? So, we don't need any blood going to the placenta. So, first umbilical artery will close. We need some blood from the placenta so that, yes, the blood from the placenta enter the newborn so that the vein will close shortly after the closure of arteries. So, first vein and then artery. Okay? So, the ductus venosus, after birth, it will form the ligamentum venosum. Okay? And the umbilical vein, the left umbilical vein will form the ligamentum teres hepatis. Okay? Right. Now, third point, the ductus arteriosus will close. Now, what is the function of ductus arteriosus? Ductus arteriosus connect the pulmonary trunk to the aorta. Now, this ductus arteriosus, yes, this will close, yes, after the birth. Okay? Now, what will happen because of that? The blood from pulmonary trunk, which in turn goes to lungs. From the lungs, via pulmonary vein, the blood will come to left atrium. Now, the pressure inside the left atrium, will increase Now what will happen because of that? The septum primum will fuse with septum segundum. Septum primum fuse with septum segundum and thereby close the, very good, foramen ovale. Thereby close the foramen ovale. Okay. So first ductus arteriosus will close. So blood from pulmonary trunk will go to the lungs and then to left atrium via pulmonary vein. Now the pressure inside the left atrium will increase. So septum primum, there is a flap like that will be moving and closing the foramen ovale. Septum primum fuse with septum segundum and close the foramen ovale. So now we have PDA, patent ductus arteriosus. Now the blood from aorta, yes, which in turn shunted to pulmonary trunk via this ductus arteriosus. Okay. Now from the pulmonary trunk, yes, to the lungs, from the lungs to the left atrium via the pulmonary veins, from left atrium to left ventricle and left ventricle to aorta. So now we have the shunt from the left side of the heart to the right side of the heart, which in turn result in, yes, this is the asynotic heart disease. Okay, right. So ductus arteriosus failed to close in some babies, which in turn result in PDA, patent ductus arteriosus, is the asynotic heart disease. Now what about foramen ovale? In 20% of the people, yes, we have a gap between the septum primum and septum segundum. Okay, so this is called probe patency of foramen ovale. That is probe patency of foramen ovale. Okay, so again this is only, yes, anatomical only, but not a functional one. So don't worry about this. Now we know that the septum primum will form after birth, will form the fossa ovalis. Very good. And septum segundum will form, very good, limbus fossa ovalis. Limbus fossa ovalis. Is that clear? Right. So we're going to write one last point in the fetal circulation. Yes, now we're going to write the closure of the various structures. First one, ductus venosus. So functional closure and the anatomical closure. Now the functional closure will occur after the removal of placenta. After the removal of placenta, anatomical closure, yes, after 7 days. Now foramen ovale will close at the time of birth after the breathing is initiated. After breathing is initiated. Now the foramen ovale anatomical closure will take months to years. Okay, sir. Now what about ductus arteriosus, sir? Ductus arteriosus will close 10 to 15 hours after the birth. Anatomical closure will be there by after 10 to 21 days. See, this is the data given in the embryology books. Okay. If there is any discrepancy between the clinical modules, please go with the clinical subjects. Okay. I am saying the data given in the embryology books. Right. This is about the closure of this various anatomical structure. Yes, that's all about the fetal circulation. So the fetal circulation, mainly you have to know about the shunt, and you have to know the remnant of the shunt, and you have to know the timeline for the closure of the shunt. Okay, right. So that's all about the fetal circulation, and we completed the development of CVS.